Or we can say that some students working under an employment contract during their practice in organizations can be also employed. And employees also are persons sentenced to imprisonment and brought to work under an employment contract, or other people working for organizations or an individual entrepreneur under an employment contract. And here you can see one word repeated. This is contract, 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 contract. So we can say that those people who have employment contract, are employees, and they can get the label of occupational disease. The next question: are all employees at risk of developing an occupational disease? And here we need to say that risk in general is the probability that a hazard or something will be realized given the nature and extent of a person's exposure to an agent or circumstance. And the occupational risk is determined by working conditions. Depending on the severity of harmful factors, there are 4 classes of working conditions. Let's look at them. So again, in general, we have 4 classes of working conditions risk. The first class is about optimal working conditions. It includes the conditions under which the employee's health is maintained and a high level of efficiency is maintained. The second class is permissible working conditions, characterized by such levels of environmental factors and labor process that do not exceed legal occupational exposure limits, like maximum permissible concentration or maximum permissible level for workplaces, and possible changes in the functional state of the body are restored during the time for rest or to the beginning of the next shift and do not adversely affect the health status of the workers in the near and long term and their offspring. The optimal, so first, and permissible, so second classes of working conditions are safe in general. The risk is very small, and we can say that if someone works with optimal working conditions or permissible working conditions, there is no chance to be affected with his or her work. Such works are safe for such employees. But the other 2 working classes are dangerous for health. So let's look at them. Class number 3, it is harmful working conditions that characterized by the presence of harmful factors, the levels of which exceed legal occupational exposure limits, like MPC or MPL, maximum permissible concentration and maximum permissible level, and have an adverse effect on the health status of the worker and or their offspring. It includes 4 degrees. We will say about them in the next slide. And the last class is particularly dangerous or extreme working conditions. that characterized by such levels of factors in the working environment, the impact of which during only one shift creates a threat to the employee's life, a high risk of developing acute occupational injuries, including severe forms, is possible here. So, class number 3 and class number 4 generally are characterized by such thing that the concentration and levels of harmful factors are exceeded here. That's why such employees can get an occupational disease or injury or trauma or poisoning. And then I said that we would talk about the third class in details. And the 4 degrees of harmful working conditions are reported for class number 3. The first degree of the third class is the working conditions that are characterized by such deviations of the levels of harmful factors from hygienic standards which lead to functional changes that recover usually with a longer than by the beginning of the next shift interruption of contact with these harmful factors and the risk of damage to health increases. The second degree of the third class. The levels of harmful factors cause persistent functional changes, leading in most cases to an increase in work-related morbidity and the appearance of initial signs or mild forms of occupational diseases after prolonged exposure. It takes 15 years and more. The third degree of the third class. The working conditions here are characterized by such levels of factors of the working environment, the impact of which leads to the development of mild and moderate forms of occupational diseases. In the period of work activity, grows up of chronic diseases. And the fourth degree of the third class is the working conditions under which severe forms of occupational diseases can occur with loss of general capacity. There is a significant increase in the number of chronic diseases, morbidity, and disability in such employees. We said that to get an occupational disease, we need to be employed officially. But if we are employees, will we get the occupational disease if we work only? Let's try to answer what diseases are occupational. The definition of this is occupational diseases are diseases that have a direct cause-effect relation with the exposure to harmful or dangerous agents of the working environment of the work process. Again, occupational diseases are diseases that have a direct cause-effect relation with the exposure to harmful or dangerous agent or agents of the working environment or the work process. You can ask me, teacher, if someone works, for example, as an anesthetist, can he get alcoholism? Because we know that many surgeons and anesthesists like to drink, and they can drink at work. So, if he is officially work or she is officially works and drinks at work, his or her alcoholism is occupational? Let's answer this. So, generally, we have three types of diseases. First is reportable occupational diseases. Second is work-related diseases. And the third is environmental diseases or non-occupational at all. Again, non-occupational diseases, purely or reportable occupational diseases, and work-related diseases that are not occupational in their basis, but they are related to work. What's the difference between them? Reportable occupational diseases are in national lists as part of national laws or administrative provisions liable for compensation and subject to prevention measures. It means that for such diseases, we have a strong cause-effect relationship. And that's why they're reportable. And they're included to national lists. What are examples of purely occupational diseases? Silicosis, hand-arm vibration syndrome, sensory neural hearing loss, and many others. It means that the relation between this disease and occupation is established. And for such diseases, the employee will get compensation and something more. We will say about it later. The second group is work-related diseases. These are all illnesses that can be caused, worsened, or jointly caused by working conditions. And they have a complex etiology, multiple etiology. And among their multiple causal agents, factors arising from the work and the working environment play a role in the developing of such diseases. What are examples? For example, blood hypertension, or ischemic heart disease, or depression. For example, in a teacher who teaches the students who do not like to read and study his subject, or chronic fatigue syndrome in a teacher who wants to teach students and wants them to be studied and he couldn't. Or alcoholism in doctors, for example. But there is no strong relation to the occupation reported. That's why for such group of diseases, there is no compensation, there is no benefit for employee. And the third group is environmental diseases or non-occupational. I think we don't need to talk about them. And further definitions concerning occupational and work-related diseases. As I said, an occupational disease is a disease or disorder that is caused by work or working conditions. This means that the disease must have developed due to exposure at the workplace, and that the correlation between the exposure and the disease is proved by medical trials. And work-related diseases have multiple causes, where factors in the work environment may play a role together with other risk factors in the developing of such diseases. The next question: where can I find the whole list of such occupational diseases? The answer is simple. We have ILO, or International Labour Organization list of occupational diseases. It is universal document for all countries. And lastly, it was revised in 2010. And all the diseases included to this list are divided into 4 groups. First group is occupational diseases caused by exposure to agent arising from work activities, like diseases caused by chemicals, physical agents, or biological agents, and infectious or parasitic diseases. The second group here is occupational diseases by target organ systems. Here we have, for example, respiratory diseases, skin diseases, musculoskeletal disorders, or mental and behavioral disorders. And especially we have a group of occupational cancer, and the fourth is for other diseases and disorders. Again, in international level, we have a document named ILO list of occupational diseases, where you can find the disease and its relation to some of harmful agent. For example, we said that why anesthetist being alcoholic isn't occupational, because for alcoholism, firstly, there is it isn't included in that list, and secondly, there is no strong relation between alcoholism and work. We can get this problem environmentally. For example, drinking after home, or drinking at weekends, or drinking at celebrating something. That's why it is not occupational disease, and it is not included to that list. And we moving on to types of occupational diseases, so classification. All the diseases caused by work can be divided to acute occupational diseases or disorders or poisonings, and chronic occupational diseases or disorders or poisonings. Let's define acute occupational diseases or poisonings. An acute occupational disease or poisoning is a disease that usually occurs as a result of a single, that takes no more than one working day or one shift, exposure of an employee to harmful occupational factor or factors whose intensity significantly exceeds maximal permissible concentration or maximum permissible levels. That results in a temporary or permanent loss of occupational capacity. So here we need a high exposure to high dose of a harmful agent at once. The next group is chronic occupational disease or poisoning. That is a disease that usually occurs as a result of long-term exposure that takes years of work of an employee to harmful occupational factor or factors, entail temporary or permanent loss of occupational capacity. And in 2013, we had a trail that revealed that in the structure of all occupational diseases, the diseases caused by physical hazards are leaders. Then we have diseases caused by ergonomics hazards, by dust, by chemicals, by biological hazards, by occupational allergens, and lastly, cancers. But if we look at this structure for 2019 or 2020, we will see that the group of diseases caused by biological hazards are leaders. Because many doctors, nurses, laboratory technicians are damaged with one of biological agents, COVID-19. What are the classification of occupational diseases? Generally, there are two approaches to classify occupational diseases. First is based on etiological principle, and the second approach based on systemic principle. However, in addition to these two approaches, which are recognized by the International Labour Organization as international, each state or country has its own national list of occupational diseases. And the first classification is systemic. Here we can see the group of occupational infections, respiratory disorders, cardiovascular diseases, skin disorders, musculoskeletal disorders, and so on. The second classification classifies all the diseases by their etiology. And, for example, in the group of diseases caused by chemicals, we have such disorders as mercury poisoning or lead poisoning. Among diseases caused by dusts, we will see occupational chronic obstructive pulmonary disease or silicosis or asbestosis or talcosis and many others. To group of diseases caused by industrial cancerogens, we can add skin cancer, leukemia, non-Hodgkin's and Hodgkin's lymphoma, and so on. Diseases caused by physical hazards. Here we have noise-induced hearing loss, vibration disease, and so on. Biological hazards can cause occupational tuberculosis, hepatitis B, C, brucellosis, COVID-19, and so on. Diseases caused by ergonomics and mechanical hazards include Dickey-Reins disease, carpal tunnel syndrome, golfer's elbow, tennis player elbow, and many others. Diseases caused by occupational allergens can include occupational asthma, allergic contact dermatitis, irritant contact dermatitis. So, moving on to the question, what are the principles of diagnostics of occupational diseases? Here we need to say that we need to be focused on, firstly, typical clinical findings, the debut of the disease and the increase in symptoms during work. Work with hazards must be confirmed by the sanitary and hygienic characteristics of the workplace. It is about exposure assessment by hygienists or epidemiologists at the country, at the cities level. The length of service in contact with the hazard from work record book or job certificate is also important. And we need to say that workers that work in a specific work can have similar diseases or disorders. And if they work and exposed to dust, they will get some kind of pulmonary diseases. Or workers who are exposed to noise, like pilots or machinery workers can be affected with that noise, and that results in their hearing loss. And all the pilots are exposed to noise, and all of them can have similar clinical picture. That's why it is occupational disease. Then we need to keep in mind occupational history, prior medical history, or anamnesis vita. In this part of interview, we need to say that before getting work or before starting work, the employee must be clean for this disease. Analysis of the patient's card or patient record and the data of the medical surveillance, pre-placement, and regular is necessary because it can demonstrate the gradual onset and the gradual increasing of the disease severity or something like that. And in diagnostic, we also have specific tests to diagnose these diseases. So again, the diagnosis is based on typical clinical findings, the sanitary and hygienic characteristics of the workplace, the job certificate data that includes the length of service in contact with the hazard, the occupation itself. It means that if the employee worked as teacher, but in reality he just cleaned the rooms, for him there is no chance to be labeled as occupational tuberculosis because he is teacher, not cleaner in the record. Occupational history, prior medical history, the data of pre-placement and regular checkups and specific tests are the other things to establish an occupational disease. The next issue, the next question is how to treat occupational diseases. And here we have such options as etiological treatment, pathogenetical treatment, symptomatic treatment, and physiotherapy. Not all, many of occupational diseases can be cured with removal. It means that if the affected employee stop being exposed to harmful agent, his or her disease can be disappear after removal. That's why we have etiological treatment for occupational diseases, and is cool. It is removing. But some of them can continue experience symptoms. That's why for them we have antidote therapy and non-specific therapy. Among antidotes, we have, for example, chelating agents or complexons like pentacenum calci, calci-editate, sodium thiosulfate, unitiolum, dipenicillamine, EDTA, and many others. And for some of diseases, we have only symptomatic treatment. For example, to relieve their pain. And in the rehabilitation, we have an option of physiotherapy, massage, gymnastics, something like that. And here are some of drugs that we can use for patients affected with their work. We said about diagnosis, etiology, we said about pathogenesis, we said about epidemiology, some kind of clinical picture and diagnosis. We've just said about treatment, and now we are moving on to prevention issues. How to prevent or recognize an occupational disease? In general, there are two types of screening exams for employees at risk that are conducted by occupational medicine providers. And we have pre-placement assessment or screening, it is before getting work, and periodic health surveillance for workers who work. Let's start with pre-employment medical examinations or screening. Why do we need to screen employees? Because, how do you think, can the blunt employee work as a driver? Or, for example, deaf person work as a teacher? Or something like that? Absolutely not. That's why we need to screen people before starting work. A pre-placement examination or preliminary medical examination is held for employees before they first start working. The purpose of a pre-placement health assessment is to establish a prospective employee's fitness for employment, including his or her ability to offer regular effective attendance. It may not be required for jobs such as routine office or computer work that has few significant exposures. The results of the examination must be kept confidential, and the employer has no right to know specific personal medical data about employee. The occupational medicine provider, after reviewing all the information, simply states whether or not the employee can perform the critical functions to the job and if restrictions are necessary. And this decision is based on the document that lists a list of contraindications for working with occupational hazards or occupations. So, in the conclusion of such a screening document, the OMP, occupational medicine provider, just states that employee can work. He is suitable for work, for example. Or there are some restrictions for this work. But there are no diagnoses, there are no diseases recorded. Only statement about his capacity, capable or not. And pre-employment medical examinations or screening includes such investigations, obligatory investigations, as a detailed revealing of complaints, physical examination, blood panel including fasting plasma glucose and total cholesterol levels, clinical urine test, chest x-ray, ECG, gynecological exam for women including mammography and vaginal smears, drug alcohol screening provided with narcologists and psychiatrists, syphilis, HIV, hepatitis B and C tests, and specific diagnostic investigations that are specific for the kind of work. For example, for minors who exposed to dust, what test is necessary? Spirometry. For road walkers who work with hammer drills, the vibration test is necessary, and something like that. This is specific diagnostic tests. Periodic health surveillance. It is the second form of routine mm, diagnostic procedures. And synonyms of this is regular medical examination, routine health screening, and many others. Regular medical examination of workers who are exposed to particular health hazards at work can detect abnormalities or diseases at the early stage, that which is essential, so that timely treatment can be given to increase the prospect. This exam is performed on workers who are already working to make sure that they haven't been injured or may heal from exposures in the workplace. And the exams may be annual or each second year, depending on the occupation. The next question arises: should healthcare provider report on occupational disease? For example, you've just diagnosed an silicosis in the employee. Do you need to report this patient to employer or policy, state policy, or someone? Yes. In many countries, reporting of all or specific subsets of occupational diseases or injuries and exposures is obligatory for clinicians and or laboratories. State-based reporting builds on the concept of occupational sentinel health events, so a disease, disability, or untimely death which is occupationally related and whose occurrence may provide the impetus for epidemiologic or industrial hygiene studies, or serve as a warning signal, red flag, that material substitution, engineering control, personal protection, or medical care may be required for this kind of work. These systems are not meant to provide true counts of events, but rather to stimulate reporting, often among sentinel providers who develop expertise in the recognition and management of occupational illnesses. Such reports provide opportunities for follow back with employers to identify workplaces at risk and emerging hazards. These systems are independent of working compensation systems. In fact, analysis of the overlap between physician reports and working compensation reports in some countries demonstrate little overlap and provide opportunities to estimate the frequency of the conditions being partially reported into both systems. I'd like to say more about clinician-based reporting. Many countries require reports of occupational illness or injury from clinicians who make such diagnoses. Conditions such as pneumoconiosis, like asbestosis, coal-workers pneumoconiosis, silicosis, or occupational asthma, or musculoskeletal disorders, and pesticide toxicity are among those most commonly defined as reportable. Clinicians can find information on reporting cases at their state health department website. For example, the United Kingdom develops READER system. It is a list of nationally notifiable conditions, and these conditions are reported from the sites to the government to provide data at the national level. The list includes conditions classically considered occupational, such as silicosis and pesticide-related illness, as well as conditions such as hepatitis and anthrax, which are often associated with occupational exposures. And we move to one of important issues. Is there any compensation for the established occupational injury or disease? Yes, there is, but only for prescribed occupational illnesses or injuries. And each country has its own set of workers' compensation laws. In general, these laws has two main sections. First, they pay for medical care and rehabilitation of workers injured on the job or made ill from their work. And second, they provide compensation to the worker for lost wages, called indemnity costs. And the rate of benefit depends on the degree of loss of occupational capacity, which is measured in percent. For example, we know that a miner worked as a mining and his salary was $1,000. He lost his capacity to continue working because of silicosis in him, and his lung capacity is damaged, is decreased. That's why he can't work in this specialty. And we established his loss of occupational capacity equals 30%. But we also know that general capacity isn't affected and he can change his work. For example, he can start working as a teacher, occasionally teacher. And if he lost his capacity by 30%, the government will provide the compensation equals 30% of his last salary. If he got $1,000, the government will pay him how much? Yes, you're right, $300 a month for his lost. And also, he'll be working as a teacher and uh, getting the salary for this. It is compensation. And moreover, the government will pay for all the diagnostic procedures, for his treatment, for his rehabilitation, and for everything related to this disease. Cool, right? The current cost of workers' compensation in the United States is estimated to be $100 billion a year. And you can ask me, teacher, where the government take money from? From employees and their employers, because they pay taxes to government. And the much risk, the much taxes. For example, we have 32 classes of occupational risk, and class 1 is the minimal. It is for healthcare workers, and risk here generally is very low. And that's why each employer pays for each of his employees, for example, $10 as tax. But class 32 is for chemical or radiation industry, which is associated with highest occupational risk. And here the employer pays for each of his employees $1,000 to government. And the government accumulate all these monies in the bank of money. And after we revealed a newbie in occupational disease, some employee affected with occupational disease, the government will pay money, will pay compensation from this foundation, from this bank of money. And the last question, why is it so important to know whether the disease is occupational or not? An occupational disease that has occurred in an employee whose employer pays taxes to the state is an insured event and therefore is guarantees the employee insurance payments and retraining at the expense of the state in the event of disability. That's why if we state that this man is affected with his work, it means that it is an insurance case. And if we spend money for a basket, the foundation will be dropped and no money in government. That's why we need to be sure whether this patient is occupational or not to save money, to keep money in the fund. And lastly, I'd like to finish my lecture with such saying. Occupational diseases have significant medical, social, and economic consequences associated with long-term, high-cost treatment, prolonged temporary disability of victims, high levels of disability, and large compensation payments. Thank you.